We're all vulnerable. We're all, I like to say, wonderfully human, meaning that darkness can overwhelm our capacity to cope on any given day. But when we look at the data, and we don't have 2020 death data yet, but we do have attempt and ideation data, which I think is really relevant to hospitals. So in 2020, there were 23,975 South Carolinians that walked into an emergency room with suicidal ideations. So that's one South Carolinian every 22 minutes in the year 2020. When we looked at the attempt numbers, there were 6,801 attempts. So that's one South Carolinian every 77 minutes walked into a hospital after a suicide attempt or was carried into a hospital after an attempt. So these partnerships with hospitals are so important. We know they're coming in your doors. Now we want to partner with what do we do once they're there. So Zero Suicide is a healthcare framework that is used not only nationwide but internationally. And so the components, the metrics for the Zero Suicide, Drive to Zero Suicide Award came from that framework. So the fact that you have 20 hospital systems that qualified for that award by meeting at least three of those 5 metrics is outstanding. And building upon that, hopefully next year it's not double that number, it's triple or quadruple that number of hospital systems that are engaging, because that's a step towards preventing it, is looking at how do we train our staff, what are our policies like. So it makes me a proud South Carolinian to see these 20 hospitals getting this award. When you look at this Drive to Zero Suicide Award, to my knowledge, we're the only state really doing this on a statewide level, asking our hospital systems to come together as a collective community and say this matters and we're going to work to address this. I mentioned the screener. We're first in the nation to do that as well as we're now building the first ever South Carolina Faith Coalition for Suicide Prevention. So there's lots of things that people are looking over the fence and saying, wow, what are they doing over there in South Carolina? Because it is innovative and proactive.